Baby, let me make sure these girls are sitting nice for this video. Hi guys, what is up? Welcome back to my channel, and if you're new here, welcome. My name is Victoria. I am a 22-year-old woman of transgender experience, and I make mostly LGBT content here on YouTube. If that's your thing, hit that subscribe button down below so that you never miss out on a new upload. Now, I did make this video years and years ago, fresh out of surgery, back in my old cinder block dorm room, and it is a very outdated, old, really honestly kind of cringy video. So I figured I'd come back here. I am several years post-op, and I'd let you know all of the trials and tribulations involving my breast augmentation. I made that video pretty fresh out of surgery, and I am several years post-op now, and the girls have gone through so much since then. Plus, that old video got demonetized, just like this probably will, yeah. So if you want to support me, make sure you are subscribed, first of all. If you're not subscribed, what are you doing, baby? You're here. You're watching my videos. I know you're coming back for weekly content. Just click that button down below and the bell so you're notified whenever I make a new video. Give this video a thumbs up. Leave comments down below. Go follow my social media. You know I got my WISIO, my merch, all this kind of stuff in the description down below. So go ahead and check those links all in the description. And without further ado, let me jump on into this video. Alright y'all, so let's just dive in. So if you are a returning subscriber, or if you watched the first 60 seconds of this video, you would know that I am a woman of transgender experience, which means that yes, I was born a boy, and at age 14 I transitioned from male to female. This was a gender affirming surgery for me, blah blah blah. You can hear all about my heartwarming story and journey in all of my other videos. But what's important to know is that I was starting off with far less breast tissue than the average cisgender patient. When I was searching for a plastic surgeon, it was super important for me to find someone that would help me achieve my goal, that would view this as a transgender top surgery and help me to get to where I need to be. I had one really bad, honestly kind of nightmare consultation that we'll get to a little later in the video. But you know, I did so much research on forums like Real Self and all these other plastic surgery websites, and I actually found the doctor that I went to from my hormone provider, my endocrinologist. If you are transgender, I would highly recommend you ask your hormone provider for a list of surgeons that they recommend. Otherwise, just make sure that you really do your research. It's better to go to someone that you trust rather than someone that is nearby and just cheap. Girl, oh my god, consultation from hell. So okay, my sister had referred me to this man, but now I didn't look much into this guy. I just knew that she had gotten it done. He was nearby, and I was like, work, let's go. So I'm driving there, and mind you, I'm driving through like a really sketchy part of town to find this man's office. So I'm like, okay. So we pull up to his office, which by the way is on the 3rd floor. Like, this is not even a self-standing operation. So immediately I'm like, what the hell? Even still, it's not like he operates in there. So I'm like, you know what, fine. So I walk into this building, and when I tell you, it was like walking into a time capsule, okay? It was like walking right into the 80s, and I'm talking like dusty, musty, old 80s. Like the chairs, the upholstery, the wallpaper, the old ass like big TVs. It was all like, I'm really not playing with you. So I am sitting in the waiting room like, they call me in, and he basically tells me to pick a size up to 800 cc. Now, if you're unfamiliar with breast implant sizes, 800 cc is literally ginormous, especially putting it on someone that had a flat chest. So that was the first red flag. Regardless, I was very, very eager. So I tried out different sizes, and we settled on 600 cc's. He kept trying to push me to go larger and larger. And he was like, you know, you're gonna get a smaller size, then regret it and want a larger one, so come on back. And he was kind of implying also that it was because I was transgender. So I wasn't a huge fan of that. We settled on 600 cc's over the muscle. He told me that he would refuse to do any transgender breast augmentation under the muscle because he just said it would be hard and uncomfortable. If I had gone to this doctor, I would have like double the size breasts that I have now over the muscle. Like, I'm wearing kind of like a bra that has some push-ups, so you do see some of the circular shape, but like it would look like that all the time. So do your research, figure out exactly what it is, and make sure that you're not so eager that you just jump into whatever is nearby and whatever is quick and fast. And that goes for finding a man too, okay? So after this consultation, I was like, I am not going to that doctor. So I reached out to my primary care physician and she told me a whole list of doctors to research. And I finally settled on Dr. Madali at Plastic and Hand Associates in South Portland, Maine. Now I am on the East Coast, so it wasn't a huge commute for me. During the consultation, they do a regular physical to make sure that you're physically healthy enough for surgery. And they do an examination of your chest pre-op to determine any kind of asymmetry with, you know, your areolas or a different kind of sizing, just to make sure that when they do the surgery, it's going to be perfectly symmetrical. When it was time for me to sit down and meet my surgeon, he made me feel so comfortable and welcome. Like he had all the time in the world for me. He sat down and he actually, the first thing out of his mouth was, this is going to be a transgender top surgery that I'm going to treat as a breast augmentation. So he sat down and he told me all the differences between a regular breast augmentation and a transgender top surgery augmentation, and how, you know, you want to make sure that you're having the right proportions, the right size, you know, more of a teardrop shape, and most importantly, under the muscle is what he said. Because look, like, I mean, even from the side, we'll get to it in a second, but like, it's more of like a teardrop shape. So we'll get to that. So he laid out a whole selection of different sizes and profiles of breast implants and told me to choose basically up to 450 cc's. He even recommended not going above 400 cc's. And the other doctor was trying to push me above 600. So I tried out all different sizes. You guys know I love a more natural look. So we decided on 375 cc's of saline under the muscle with the incision underneath the breast fold. Now I did originally want silicone breast implants rather than saline because they just felt a little more natural to me, even though saline is safer. But unfortunately, the FDA does not approve the use of silicone in anyone under the age of 21 in the United States. Oh, honey, over 21, honey, if silicone gets you drunk, honey, I'm wasted, honey. I was very comfortable. We had agreed on a size, and so we set it all up with billing, and I had an appointment for August 30th, 2017 to get my breast augmentation. I was beyond excited. When it comes to billing, some surgeons and some insurance will cover it, some won't. So I did try many times with different insurance providers, and unfortunately none of them would cover my surgery. So I did pay for all of this out of pocket. Yeah. Surgery day comes around and I am so excited. Like, I mean, I'm kind of skinny now, but like I've always been very thin, and I was extra skinny at this point. So I had a flat chest, honey. So I was done with it. I was done with having no titties, and I was just ready to go and get my surgery. So I get in there, they do a regular checkup, and the anesthesiologist goes, okay, honey, so I'm just gonna put your IV in and we're gonna put your meds in and put you to sleep. And I was like, great, wonderful, pump me full of this, put me to sleep. Baby, she goes to put my IV in, and she is like digging around my skin. She can't find the vein. I see at one point she literally almost pokes through the other side. I was livid. I already hate like needles and like IVs and stuff anyway. It's just so, especially IVs. I think everyone hates IVs, but I was already so miserable, and I was like, ow. And she goes, did I hurt you? And I was like, yeah, you hurt me. Like, hello. That shit left a bruise and swelling literally the size of like half a ping pong ball on my arm. It was so bad. So finally we get the IV in, and I'm just sitting on this table, you know, ready for surgery. I got wires in me. I got a full head of extensions. They put the anesthesia mask on me and told me to come back from 10. So I was like 10, 9, 8. Bitch, I was out. Next thing I know, I'm waking up from surgery. It's not fun anymore. I'm in the recovery room and I am in an immense amount of pain. Honestly, one of the most uncomfortable surgeries that I've ever had. It felt like I had an elephant sitting on my chest. There was just so much pressure. And, you know, I remember just feeling nauseous and thirsty at the same time and just in so much pain. It was really bad for the first hour or two, and then my meds kicked in and I was pretty much fine after that. For the first like month or couple months, I had what I called Franken boobs. So they were really high up, they were hard, they were kind of square looking because your body is, especially if it's under the muscle, it's squeezing them because it doesn't want that in there. So it's just like, it's not used to it, it has to stretch. So it looks crazy at first. But as you can see, I mean, they've fallen, they're jiggly. It took about 3 months for them to drop and look normal, and about 6 months for them to feel normal. And now I am 17, 18, 19, 20, 21. I'm 4 years almost, like 3.5 years post-op, and I feel great. I mean, I don't have any pain. I will say, I mean, like, sometimes if I'm not wearing a bra for, you know, a whole day, or if I slept without a bra on, or like a sports bra, then I will kind of feel a little bit of pain or a little sore, and I'll put on a sports bra for some support. But I feel like that's anybody with some big boobs, like that's just gonna be uncomfortable. Overall, I love my breasts. I feel like they fit my frame perfectly. You are supposed to change them out about, like, I think every 15 years. So when that happens, I will probably go up in size, just because why not? So I'm thinking of going from 375 in saline to 450 in silicone, but all in due time, baby. I'm sure you'll be coming with me for the whole journey. So I'm like 4 years post-op, and I have had no complications, thank God, knock on wood. But you know, I've had no issues. They are still very soft. They haven't, you know, they were dropping at uneven rates at first, but I mean, they're fully dropped now and they look bomb. So if you're a trans girl watching this and you're thinking about top surgery but you're scared, or if you just want to change something about your body to make yourself feel more comfortable, girl, go for it. It is worth every single penny. It has totally changed my life. I will say, like, I'll be talking to people, and especially if I have a lower, I mean, you know, obviously right now, if I'm talking to somebody and I have a lower cut top on, for the first time in my life, I got like pissed because people would be talking to me and looking down and up and down and up, and I'd be like, hello, up here, hello, up here. I am so happy and grateful that I was able to get my breasts done, and I would recommend it to anybody that wants it. So if you have any other questions for me about my transition or breast augmentation or anything else, please, please, please leave them in the comments down below. I love to hear from you. If you have a specific question for me that you want like a little more specific attention for, a one-on-one call, a mentorship, a personalized video, click the link in the description at wisio.com/VictoriaRose, and I am available for all of your questions and requests. Alright guys, that is going to be all for this week's video. As always, thank you so much for tuning in. Make sure you hit that subscribe button down below so that you never miss out on a new upload every single Wednesday. Hit that like button, comment down below, follow me on all my social media. I am much more active on Instagram, so go ahead and follow me there if you want to get involved with polls, Q&As, and any other kind of interactive content. I love you all so, so much, and until I see you next Wednesday, good luck. I love you. Bye.